Welcome back to the Dental Deep Dive. I'm Yvette, and today we're going to be tackling a topic that everyone has seen but does not completely understand: your dental treatment plan. But before we get into this episode, hit that subscribe button, because again, I'm going to bring you some great information that you definitely don't want to miss. So hit the subscribe and like. So, just to do a recap, this is a 3-part series that we're talking about dental insurance. And I might have to take it a little bit longer because as I go to work day to day, I'm starting to realize more and more people really don't understand their dental insurance and how it actually works. So, this might end up being more than 3 parts. But anyway, the first episode was about understanding the difference between a DHMO, an HMO, a PPO, and an in-office plan. And then the second episode, I brought in a front desk diva, Miss Cece. Thank you, Miss Cece. And Miss Cece broke everything down about understanding the questions you should ask your dental carrier before purchasing your dental insurance. And we also broke down what's the best insurance policy between that DHMO, HMO, PPO, and in-office plan for you and your family. So we broke all that down. So today we're going to be talking about that sheet of paper that everyone receives at the dental office that says treatment plan on it. And it has all these codes and these numbers and prices, and you don't understand what it's about. So today, I'm going to talk about what those codes really mean and how you could even call your insurance company with those codes to get a clearer idea of what's covered and what's not. Let's break it down together so you can make a confident, informed decision about your dental care. Let's dive right in.
When you look at your treatment plan, it may seem like just a bunch of codes and numbers. But here's the breakdown. The procedure code is how insurance identifies your treatment. The description tells you what that treatment is in plain terms. The fee is your dentist's price. The insurance portion is what your plan is estimated to cover, and the patient portion is what you're responsible for. Notes may show pre-auth needed or other important details. Always remember, it's an estimate, not a guarantee. That's why calling your insurance with the procedure codes can give you a clearer idea before you start treatment.
That went by so quickly, I decided to slow things down a little bit and go over a treatment plan case that was presented to me back in 2021. So this is an actual treatment plan that was given to me. So the first thing you would notice here on your treatment plan is the date. So that would be the date of service, the date that you actually came into the office and seen the doctor. The second thing you would notice on this treatment plan is visit. Visit says 0 on mine, but basically what that would be is if you were having, say, a crown done, you can do it in 2 and 3 steps. So it will show per each visit what would be done. So in my case, everything will be done in 1 day. Now they're going to be working on tooth number 13. That will be in the 3rd slot here. Now on the top where it says code, that's the procedure code. Every treatment has a CDT code. This is what your insurance company uses to decide coverage. And then next to that is provider. The PROV is the provider. In bigger offices, there's more than one doctor, so they will have a special code so we'll know what doctor treated you. And that also is important to the insurance company because not all doctors are in network with particular insurance companies. So it's very important to know what doctor worked on you. And then the next is the description of service in plain language for the procedure. So that's like if you, in my case, it says surgical place implant. That's what my treatment is for, an implant. And in the next slot, it's the cost of the procedure or fee. This is the dental office full office fee before it's sent to insurance. And then the next spot it says patient portion. The patient portion is an estimated balance, what you're expected to pay out of pocket. This includes deductibles or anything insurance doesn't cover. So it's important to understand that these are just estimated fees right now. And then in the last slot, that's the insurance portion. That's the amount that's billed to the insurance company. And it's based on what your plan might cover. And it's usually shown as a dollar amount or a percentage. And then you could also, before you start any treatment, you can have the office or the treatment coordinator to submit a pre-authorization to your insurance company before you have anything done. This way you'll have a better idea of what will be covered and what your out-of-pocket portion will be. And that's the best way to tackle and understand your insurance. The other part is you can also take those CDT codes and call your insurance company and get a better idea of it exactly how much would be covered and what your out-of-pocket expenses will be. And that's how you take control of your treatment plan, by understanding those codes and making your insurance work for you, not against you. And in our next episode of the Dental Deep Dive, we're going to push the conversation a little further. We'll talk about pre-approvals, benefit limitations, and those strategies dental offices use to help patients maximize what their plans will actually pay for. If you ever wonder why your dentist recommends certain steps before treatment starts, or how to avoid those surprise bills, trust me, you don't want to miss it. I'm Yvette, and this is the Dental Deep Dive, where I keep it real, one tooth at a time. I almost forgot. If you enjoyed the information that I'm sharing with you, please hit the like button, hit the subscribe button, and hit that notification so you'll know when I upload a new episode of the Dental Deep Dive.